Hi there. Today we're going to be talking about cardiac physiology. By the end of this section, you will be able to relate heart rate to cardiac output, describe the effect of exercise on heart rate, identify cardiovascular centers and cardiac reflexes that regulate heart function, distinguish between positive and negative factors that affect heart contractility, summarize factors affecting stroke volume and cardiac output, describe the cardiac response to variations in blood flow and pressure. The autorhythmicity inherent in cardiac cells keeps the heart beating at a regular pace. However, the heart is regulated by and respond to outside influences as well. Neural and endocrine controls are vital to the regulation of cardiac function. In addition, the heart is sensitive to several environmental factors, including electrolytes. Resting cardiac output. Cardiac output, CO, is a measurement of the amount of blood pumped by each ventricle in 1 minute. To calculate this value, multiple stroke volume, SV, the amount of blood pumped by each ventricle, by heart rate, HR, in contraction per minute or beats per minute. It can be represented mathematically by the following equation. CO equals HR multiplied to SV. SV is normally measured using an electrocardiogram to record EDV and ECV and calculating the difference SV equals EDV minus ECV. CV can also be measured using a specialized catheter, but this is an invasive procedure and far more dangerous to the patient. I mean, SV for a resting 70 kilogram individual would be approximately 70 milliliters. There are several important variables including size of the heart, physical and mental condition of the individual, sex, contractility, duration of contraction, preload or EDV and afterload or resistance. Normal range for SV would be 55 to 100 milliliters. An average resting HR would be approximately 75 beats per minute, but could range from 60 to 100 in some individuals. Using these numbers, the mean CO is 5.25 liter per minute with a range of 4 till 8 liter per minute. Remember, however, that these numbers refer to CO from each ventricle separately, not the total for the heart. Major factors influencing cardiac output. Cardiac output is influenced by heart rate and stroke volume, both of which are also variable. SVs are also used to calculate ejection fraction, which is the portion of the blood that is pumped or ejected from the heart with each contraction. To calculate ejection fraction, SV is divided by EDV. Despite the name, the ejection fraction is normally expressed as a percentage. Ejection fractions range from approximately 55 to 70%, with a mean of 58%. Exercise and maximum cardiac output. In healthy young individuals, HR may increase to 150 beats per minute during exercise. SV can also increase from 70 to approximately 130 milliliters due to increased strength of contraction. This would increase CO to approximately 19.5 liters per minute, 4 to 5 times the resting rate. So a 40 years old individual would be expected to hit a maximum rate of approximately 180, and a 60 years old person would achieve a HR of 160. Abnormal heart rates. For an adult, normal resting HR will be in the range of 60 to 100 BPM. Bradycardia is the condition in which resting rate drops below 60 BPM, and tachycardia is the condition in which the resting rate is above 100 BPM. Trained athletes typically have very low HRs. If the patient is not exhibiting other symptoms such as weakness, fatigue, dizziness, fainting, chest discomfort, palpitations, or respiratory distress, bradycardia is not considered clinically significant. However, if any of these symptoms are present, they may indicate that the heart is not providing sufficient oxygenated blood to the tissues. The term relative bradycardia may be used with a patient who has a HR in the normal range but is still suffering from these symptoms. Most patients remain asymptomatic as long as the HR remains above 50 BPM. Bradycardia may be caused by either inherent factors or causes external to the heart. While the condition may be inherited, typically it's acquired in older individuals. Inherent causes include abnormalities in either the sinoatrial or atrioventricular node. If the condition is serious, a pacemaker may be required. Other causes include ischemia to the heart muscle or diseases of the heart vessels or valves. External causes include metabolic disorders, pathologies of the endocrine system, often involving the thyroid, electrolyte imbalances, neurological disorders including inappropriate autonomic responses, autoimmune pathologies, overprescription of beta blocker drugs that reduce HR, recreational drug use, or even prolonged bed rest. Treatment relies upon establishing the underlying cause of the disorder and may necessitate supplemental oxygen. Tachycardia is not normal in a resting patient but may be detected in pregnant women or individuals experiencing extreme stress. In the latter case, it would likely be triggered by stimulation from the limbic system or disorders of the autonomic nervous system. In some cases, tachycardia may involve only the atria. Some individuals may remain asymptomatic, but when present, symptoms may include dizziness, shortness of breath, lightheadedness, rapid pulse, heart palpitations, chest pain, or fainting, syncope. While tachycardia is defined as a HR above 100 BPM, there is considerable variation among people. Further, the normal resting HRs of children are often above 100 BPM, but this is not considered to be tachycardia. Many causes of tachycardia may be benign, but the conditions may also be correlated with fever, anemia, hypoxia, hypothyroidism, hypersecretion of catecholamines, some cardiomyopathies, some disorders of the valves, and acute exposure to radiation. Elevated rates in an exercising or resting patient are normal and expected. Resting rate should always be taken after recovery from exercise. Treatment depends upon the underlying cause but may include medications, implantable cardioverter, defibrillators, ablation, or surgery. A correlation between heart rates and cardiac output. Initially, physiological conditions that cause HR to increase also trigger an increase in SV. During exercise, the rate of blood returning to the heart increases. However, as the HR rises, there is less time spent in diastole and consequently less time for the ventricles to fill with blood. Even though there is less filling time, SV will initially remain high. However, as HR continues to increase, SV gradually decreases due to decreased filling time. CO will initially stabilize as the increasing HR compensates for the decreasing SV. But at very high rates, CO will eventually decrease as increasing rates are no longer able to compensate for the decreasing SV. That's it, dear students, for today. Please subscribe to my channel, put your comments on comment section, and give me your likes. See you. Bye.